Right, so for our first case, we have a 12-lead ECG. It's of a 45-year-old man with apprehension. So what is the most likely ECG diagnosis? The options that we've given are sinus bradycardia, first-degree AV block, misplaced limb leads, and none of the above. So just have a look at the ECG. Right, so quite clearly what we have over here is a basic approach to any ECG, and what we would want to do is look at the calibrations throughout, and obviously the paper speed as well. Over here, indeed, what we have is we can see immediately that rather than 25 millimeters per second, we've got 50 millimeters per second. And definitely what's going to happen is whatever heart rate we have, or whatever atrial depolarization or ventricular depolarization rate we have, it's going to be halved, and it's going to appear. So whether it's, let's say it's around about 45, it will appear, if it's 90, it will appear as 45 on the ECG. So what we can see over here is the calibration is inappropriate. So beyond this, we can just, we can ensure that before moving on, we look at it and we can immediately exclude sinus bradycardia and first degree AV block, because we know that these intervals are not correct. And with all of this, what we can say is that obviously the bradycardia cannot be correct as well until we actually correct the paper speed, or we have to double this particular rate. And this definitely, when doubled in between the two QRSs, will be beyond the rate of a double of a sinus bradycardia, meaning more than 60 beats per minute. Misplaced leads, well, we've got our 2-3 AVF pointing out rightly with the P waves. There isn't any abnormality in the structure of this gentleman. The vectors seem appropriate, so there's no question about the misplaced leads. So therefore, really, neither of the three options are actually correct. And when we corrected the paper speed, obviously what we got was a normal kind of you could say, appearing 12-lead ECG, as you can quite correctly be seen now that 25 millimeters per second is the correct paper speed now, and the rate has actually gone up to somewhat around about 80-90 beats per minute. So I hope this helps. The basic learning point from all of this is it's quite important to realize that before moving on to concluding an ECG diagnosis, it's very important to conclude whether the ECG is fully calibrated and standardized. Thank you for watching.